This is Vandalia Health Mon Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Vandalia Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. At Vandalia Health, we don't just practice medicine, we care for people like family. Once again, welcome to this edition of Vandalia Health Mon Talk.
And good morning. Welcome to the program. We appreciate you joining us. I'm Kyle Wiggs. In the studio with me is Dr. Eddie Campbell, Superintendent, Monongalia County Schools. Good morning.
Good morning, Kyle.
Good to see you again.
Yeah, you too.
With us on the phone is Karen Friggens. She is Vice President, Physician Services for Mon Health Medical Group, Vandalia Health. And Karen, good morning. Thanks for coming on.
Good morning. Thank you.
We're going to talk about the collaboration between Vandalia Health and the Monongalia County school system. So first of all, Karen, tell us a little something about you and what you do, what your day-to-day duties are, and are you based here in Morgantown?
Good morning. Yes. So I'm Karen Friggens. I'm the Vice President of the medical group. As you mentioned, my responsibility is really I oversee all of the providers and outpatient locations throughout our region. I've been in Monongalia County now for my entire life, actually, born and raised here. I have two kids that one graduated from local school and one still in school here in Mon County. I drive recruitment and add new services throughout our region for Mon Health and Vandalia Health.
Okay, so how many locations are we talking about? You service them all, right? You travel amongst the locations?
I do. I have about 60 locations around kind of the middle of the state north. So as far south as Elkins, Webster County, etc.
Very good. Well, again, we're talking about the collaboration between Vandalia Health and the Monongalia County school system. So, Eddie, let's start with you on that. How would you describe that, the way the two entities work together?
Well, I think it's developing into a really great partnership between us and Mon Health. You know, one of our really responsibilities to our community is to develop these business partnerships so that we can better serve our community here in Monongalia County. And, there's a lot of ways that we can work with the health system here to help them and, again, to better our community.
So, again, your students graduate from the high schools, the three county high schools, and some of them go on to WVU with the goal of working in the healthcare industry. Also, you have the MTech programs, right, that turn out people that work in the operating rooms and work directly with the patients. So, kind of talk about that a little bit, how those MTech programs have developed.
Well, they're growing. The medical professions at MTech, and those programs that we have there are some of our most popular programs among our students. In many cases, unfortunately, we have waiting lists in those programs for kids who want to be a part of that. And I think part of the popularity of the program is that when these students finish, that gives them a lot of options. They can go directly into the workforce at the hospital if they so choose, because they're going to be prepared to do that. Or if they are looking at doing something different, they'll have the ability to enroll in medical profession coursework at WVU or any of our colleges and universities. And so really we're preparing those kids at MTech twofold for what direction they want to go in. But again, it's a direct line into the health system that we're trying to get those kids ready for.
Karen, have you seen that aspect grow, the people getting into the medical profession through the MTech route?
Oh, absolutely. We partner with MTech on a number of different initiatives. Their healthcare or their internship program, we participate in that. We also offer, like students who are in the medical assistant program, we actually offer them to do their clinical rotations within our facilities. So they're getting that real life, hands-on experience outside the classroom that really fosters and strengthens their ability to be in the healthcare workforce.
No, you can't beat that at all.
No, Karen hit the nail on the head. I mean, that's really the face of education today, especially in our programs like MTech. And that's the beauty of these partnerships is that organizations like Mon Health are opening their doors for our kids to come in and get practical work experience that really lays the foundation for them being able to walk directly into these professions as soon as they're graduated from our programs. And so it's a wonderful partnership.
What makes Monongalia County unique in that regard? The school system here is certainly robust. I mean, you've got tremendous support with the levy. And again, it's a special community because education really, really matters here.
And I think that's the point. I mean, in this community, the expectations that the people in this environment have for the public school system is really very high. Our intention is to live up to those expectations. And part of that is to put out a good product. Our product is our kids when they finish with our programs. And if we can contribute and have those kids add back into the community when they're finished, that's really our ultimate goal. And to develop those partnerships across the board really helps strengthen our programs.
Karen, anything to add to that?
No, I mean, he said it well. It is really that unwavering commitment in this community to excellence in education. And both schools and health systems serve as major anchors in this community, and their dedication is evident in the way that they support the people who work and live here. So.
Yeah, and Karen, it's pretty much the same way in other places too, in a sense that the school system and the healthcare system, if it's there in a community, they're among the largest anchors and employers in any region. So do you see that in these neighboring counties as well?
We do. Obviously, I think West Virginia does a great job in building great school systems. And from my perspective, strong local schools are vital contributors to the health and vitality of any county. It fosters environments where students and families and staff can feel connected and supported, which positively impacts overall well-being. So the connection between education and healthcare not only improves individual outcomes, but enhances the community's resilience and vibrancy. So I see that around our region, not just in Mon County, but around our region.
We are with Karen Friggens, Vice President, Physician Services, Mon Health Medical Group and Vandalia Health, and Dr. Eddie Campbell, Superintendent, Monongalia County Schools. And Karen, you said you travel all over the region, dozens of locations. Do you sense that maybe here in Monongalia County there's a little bit of a head start with the students being interested because a lot of these students have grown up with these large medical facilities in their neighborhoods, and pretty much everybody knows somebody who has worked with one of the medical systems here in town?
Yeah, I mean, throughout our facilities in the region, we actually have, quite a history of family members who are not only patients but also employees. So we have, we see that, continue throughout the region. And being, that healthcare is such a prevalent area, we're very fortunate in the state to have the healthcare systems that we have. And, so you see that continuously throughout all of the different communities where multiple family members work for part of the same organizations. We do see that throughout Mon Health and other areas as well. So it's definitely a driver, and having those strong education backgrounds that the schools support, healthcare really goes a long way. We have programs in place where we can look for students who are in different healthcare programs. We can help also align them to work in facilities that's closer into the communities in which they grew up and lived, which is where they want to go back to. So we do a lot. We pay a lot of attention and have an emphasis on how we can help keep students and families in the communities in which they live and support those initiatives.
Eddie, you mentioned something very early about the expectation of the excellence of the school system. That's the expectation here. So strong schools, there is a correlation between strong schools and business activities, prosperous healthcare facilities. So how do you see the quality of Mon County schools impacting that economic activity?
Well, I think it's a combination of both. We have a thriving business community here in Monongalia County, and I think part of that reason that the school system has been so strong for so long is because of that expectation that's been placed on the school system to be able to get kids ready to come back and continue to support this community, to keep it where it is today from a business standpoint. And I really think that's, again, the blessing for the school system of having that expectation placed on us, really, is that the community's so open to supporting the school system. We don't get a lot of no's. When we go out and ask for things from our community, whether it's supporting our MTech programs or providing those partnerships and those opportunities for hands-on learning, our community really welcomes us with open arms, and that's really why I say it's a win-win for both groups. And
Karen, Vandalia region's largest employers. So again, with the population and the strong education system, how does that play a part in sustaining the workforce?
Yeah, so obviously strong schools play a vital role in making the community more appealing to families and businesses. So when families are considering where to settle down, the reputation of local schools is usually a significant factor in their decision, right? I can tell you, in recruiting providers, we recruit over 100 providers in Vandalia North every year. And one of the top 3 questions when I'm meeting with these physicians looking to join our team is, what are the schools like? So it's such an important aspect when we're trying to recruit and retain people. So employers are naturally drawn to areas with well-educated workforces, just like we are, and so that leads to innovation and greater productivity and recruitment aspects, like I mentioned with physicians, which is a critical component to healthcare.
We are with Karen Friggens, Vice President, Physician Services, Mon Health Medical Group, Vandalia Health, and Eddie Campbell, Superintendent, Monongalia County Schools. We're going to take a quick break. We will return. Stay with us. The conversation will continue right after this.
Now back to Vandalia Health Mon Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Welcome back to the program on this Monday. Dr. Eddie Campbell, Superintendent, Monongalia County Schools, with us. Karen Friggens, Vice President, Physician Services, Mon Health Medical Group. And Karen, one of the things you said early was you talked about the medical assistant program and the fact that students are in the hospitals working alongside the professionals that they someday would like to be. So if you could kind of get into that a little bit, how that works and how that program has grown.
Yeah, so we partner with MTech and a couple of other, agencies as well, but we partner predominantly with MTech to bring those medical assistant students into our outpatient clinics to work alongside of our experienced staff, and that's giving them that hands-on education and experience within the real environment. I think sometimes we lose sight of how very different in the classroom is versus the real world experience. Many of our clinic locations, we can see 150 patients a day within that clinic. So having those students in there and seeing what that looks like and how that really functions and giving them that direct resource and mentor to really provide that hands-on education is priceless. We've seen it grow over the years. Usually our spots are full. So looking to expand, the ability to have even more students in our facilities getting that experience.
What can you add to that, Eddie?
Well, I think Karen gave a great description of what that looks like, and it's one thing for our kids to gain those classroom hours that they have to have and get that knowledge that they need before they go out, but to actually have the opportunity, and this is where I see our kids shine. When our kids talk to me about their experience in these types of programs, the medical assisting program, the reflection that they have is they like being out in the field doing the work side by side with medical professionals who have been doing this for years. They get excited about that. And I think that's really why those programs have really taken off. Kids don't learn the same way that you and I did, Kyle, back in the day.
Yeah.
They're active. They're pursuing those experiences where they can get their hands dirty. And do the work, and they want to be active, and that's why these programs are so successful and so important to our community.
Yeah, that's all true. And again, if someone is not college bound, this is another very, very attractive option.
It is, and it could also lead to college if they choose to do so. I've talked to some of our kids in the medical assisting program, and they actually plan on going to med school.
Okay.
And this is just a good way for them to get into doing something that they really love in an academic setting and developing that background. But again, we're training these kids so that if that's not the path they want to choose, they're going to go right into an opportunity to work. And believe me, and I think Karen could attest to this, the opportunity to work right after school is there if these kids really want it.
Mm-hmm. Karen, what do you
Absolutely.
see? What do you see as the future of this program in terms of growth and just becoming more robust?
Yeah, so a couple of things I'll point on. One thing I want to mention, many of the students who come out of the medical assistant program, once they enter our workforce and continue to work within our facilities, they want to grow and learn even more. So we see many of them that will go on to become an LPN. We see those LPNs go on to become RNs. And so it really is, that transitional phase for them to come out of high school, get into the workforce, and really explore where they want to be within their career. And we support all of those initiatives within our organizations. And so the other aspects of what we're doing, too, is we started something called the Healthcare Showcase. It is an annual event that we put on. We invite kids from multiple different counties, high school kids from multiple different counties. We'll have over 400 kids in attendance, an all-day event exposing them not only to the clinical positions that are available in healthcare facilities, but a variety of other roles and positions that are available depending on what their interests are. So trying to expose the students at an earlier age to different aspects of healthcare and what options are, continues to build a strong collaboration between healthcare and the schools.
Now, is that event coming up? Is that a springtime event, or when does that happen?
Yes, it will be sometime this spring. Usually it's somewhere in the April-May timeline.
Okay.
Before school lets out. Yes.
We've got a couple minutes left. I want to give you each an opportunity to answer this. What gives you the most optimism about the future of this area and our people and students, both from a healthcare perspective and an education perspective? Karen, we'll start with you.
Yeah, I think, again, we touched upon this earlier. It's really the emphasis here in Mon County that we put on education. That drives so many different aspects of a thriving community. The strong schools just don't educate our children. They cultivate healthier people, and they strengthen relationships, which creates, resiliency within our local economy. So investing in schools is really investing in the whole community and, to continue to really put an emphasis and drive that message is really important. And I think we do a really great job of that. I mean, some of the additional initiatives that the county school has been looking at, how do we expand programs? Eddie mentioned early on in this show that, many of those MTech programs are at capacity. How do we look to expand that and allow more students to have an active role in those types of programs? So I look forward to what the future brings and the constant contributions that are being made within the communities, not only through our schools, but through local businesses as well.
Eddie, you got about a minute.
For me, it's about opportunity for the kids. That's a personal goal of mine is finding ways to provide as many opportunities for our kids to grow so that when they are finished with school here in Monongalia County, they can be productive citizens. I love the partnership that we have with Mon Health. They've been open. They welcome us with open arms, and that all comes back to the kids and the opportunities that we're giving them.
Well, keep it up. Right? Continue to grow together. That's the goal.
Thanks, Kyle.